our most favourite intervention is the Tree of Life.
My first session was just explaining what it was, and he was like, oh, okay, I think I can get involved in this. He's really proud of it. We have a look at it and I say, wow, like, it's amazing. And he goes, yeah, it is amazing.
Being able to make choices and making decisions, building his self-esteem as well, I guess, through doing things well.
It's quite empowering for him, actually.
So thanks for joining us as part of Therapy Talks. Maybe you can introduce yourself to the listeners.
Yeah, my name's Chelsea and I am the Assistant Psychologist at Supercare. I work across London homes and the Eastbourne homes. So thank you for having me.
So Chelsea, as our Assistant Psychologist, you're doing lots of therapeutic work with our young people. And I think for both of us, our most favourite intervention is the Tree of Life. So the Tree of Life is a therapeutic intervention that uses a tree to represent or symbolise different aspects of a person's life. So for example, the roots might represent where the young person comes from, their background and their history. The branches might represent the young person's hopes and dreams, and the leaves might represent the people that they care about and the people that matter to them. And so could you tell us a little bit about how you're using the Tree of Life with some of our young people? And I'm really interested in hearing about how you've adapted this intervention to be quite creative for young people with learning needs.
Yeah, so I'm doing the intervention with a young person at the moment who has learning needs. So we've adapted it and got quite creative actually. So we've started with the roots, as you mentioned, and talking about his present life, and we've done like the activities he likes doing. So we've cut and stick little photos of, for example, trampolining that he loves doing, and we've done his routines. So we went through together, like what would you do waking up in the morning, what would you do in the afternoon, what would you do in the evening. So we have stuck them on, which was really nice. We did it on a bit of a timeline. But yeah, we've got really creative with it. We're going to go in the garden and pick some twigs, and we've got little bits of grass that we can stick on, which is a bit messy, but it's all good. So yeah, we've got quite creative with it.
So I guess the idea is to make this intervention as creative as possible, to bring in both kind of sensory elements, but also when you use creative tools, it's less directive and it's more fun and creative for a young person to engage in.
We should probably credit Nikazela Nakube for her brilliant work in this area. And how do you feel that the young person's experiencing the sessions based on perhaps a little bit of an abstract concept? As a tree, representing their life?
My first session was just explaining what it was, and he was like, oh, okay, I think I can get involved in this. So we've created it, we're painting it, and he really likes it. He actually looks forwards to the sessions. Sometimes he doesn't want to come, sometimes he does. But
And do you feel that he's understanding the concepts and what your how it relates to his life?
So in the first session, he's got learning needs. So I went in quite child-friendly, explaining it, but I thought maybe I need to go back and actually speak to our speech and language therapist and how I could adapt it and kind of have a different approach. And I tried that and it's actually working really well. He works really well with the visuals. So we're cutting and sticking and then going into the garden and finding stuff. So it's quite active. And I think that's how he likes to get involved. And yeah, we have obviously conversations throughout.
One of the really lovely things about Tree of Life is that part of the purpose of it is to think about where, going forward, young people can draw their strengths from, and thinking about rewriting narratives and where they want to put their own emphasis. And one of the other lovely things that you've done is not felt restricted by doing therapy inside. You've also taken, as I understand it, therapeutic approaches outside.
Exactly that, actually. We've been going into the garden and collecting twigs. So we're going to put it on our tree. It's basically just a template, and then I'm guided by the young person on what they want to add. So we kind of work collaboratively together to think about what he wants to put on it. It can travel in all sorts of directions based on what he wants. But yeah, we've been going outside and exploring.
And how would he describe his tree?
He's really proud of it. I always praise him. As soon as he comes into the session, we have a look at it and I say, wow, like, it's amazing. And he goes, yeah, it is amazing. And then he said to me the other day, I'm really enjoying this. So it's really nice to see the work and him putting his kind of stamp on it, I guess.
Yeah, and the impact of that.
Yeah.
But also using the tree of life in a creative way allows the process to be a bit slower. So the young person you're working with can really sort of resonate with some of the intervention and understand some of the ideas and concepts that you're sharing with him, and seeing this piece of work grow and enhance over time. I mean, how many sessions have you had with him so far?
I think it's about 4 now.
Yeah, and how far into the intervention are you? How much of the tree have you completed?
We're at the bottom actually. So I was planning on doing 1 session for each aspect of the tree, but the more I've got talking to him, the more he wants to actually kind of delve into the different parts of the tree. So we've started at the ground, and obviously that's the present life part. So there's a lot of conversations around family and activities and school. So I've taken a little bit longer to kind of explore those with him.
I was just thinking about this being sort of a template for other experiences, because he's learning a lot through this experience and thinking about, being able to make choices and making decisions and feeling, building his self-esteem as well, I guess, through doing things well.
It's quite empowering for him actually to have control over what he wants to put on his tree of life. By going into the garden and picking up the twigs, it helps him with his fine gross motor skills as well. So it's got that occupational therapy aspect to it. So it's kind of a holistic approach, really.